I'm Ketty Ledan. I live in Homestead, Florida. I was born in Port-au-Prince, Haiti, and I love Miami. It reminds me so much of Haiti. I used to work for the Miami-Dade County Health Department as a health service manager. I'm now retired, happily retired since 2013. We have 3 boys. We have 4 grandchildren, 2 boys and 2 girls. I love dancing, I love laughing. People think I'm the life of the party. About 2 years ago, my kid noticed that I was just sliding my leg. I was not lifting, I was not walking. I didn't even notice that. I stopped driving because I could not feel the pedal. I had no kind of feeling on that leg. So on July 3rd of last year, coming from my bathtub, I fell and I twisted the foot. It was very painful. My husband decided, he said, Ketty, let's go to Baptist.
During her evaluation in the emergency room, she'd had imaging of her head done that had shown that she had this left-sided brain tumor that was causing pressure on the brain. And the tumor looked like it was something that we call a meningioma, which is, a tumor primarily of the lining of the brain that then pushes down on the brain, causing pressure on the brain.
I was in shock. I didn't have any negative feeling or anything like that, but I knew that something had to be done, so I was ready for it.
What was unusual about Ms. Ledan's case is that the tumor she had was located in a central part of the brain that was causing pressure on the primary cortex or surface of the brain that controls the function of her right leg.
Her tumor was quite sizable. It measured about 6 centimeters and was pressing the brain and caused a lot of inflammation and edema around the brain. That's why she was having the symptoms of right side weakness. That type of tumor, most of the time, is a benign tumor, although there's some variants that could be a little bit malignant. Most of them are benign, and when they're totally resected, the patients tend to do very well.
I saw Dr. Wicks. He just shared with me about the finding of the MRI, and he explained to me what they could not wait. They had to have surgery.
So before her surgery, we did do a procedure with my colleague, Dr. Debus, to first do an angiogram to look at the blood vessels, and then to do a procedure called an embolization to close down some of the blood flow to the tumor.
The procedure that we were asked to perform to assist in the surgery is called tumor embolization. So it's a minimally invasive catheter-based procedure where we go with a little catheter either through the groin or through the wrist, and we get very close to where the tumor is, and basically we embolize the vessels that feed the tumor. Embolize means that we're blocking those vessels with any kind of material and devices that we have available, and basically when that's done, you start to have like necrosis of the tumor, so that actually facilitates resection, makes the tumor softer, and of course, because most of the blood supply is already blocked, there's less blood loss during the surgery.
During the surgery, I worked closely with Dr. McDermott, and together we were able to remove the tumor in expedited fashion.
All my family, they were excited. She can move her leg. Look at, she moving her toes. Because the day after the surgery, I was moving.
She's getting back to all of her normal activities, such as cooking and traveling. She's really had an excellent recovery.
In the grand scheme of things, she had a remarkable outcome, and her prognosis is excellent.
If diagnosed with a brain tumor, it's important for a patient to seek care at a center that is very experienced in the management of a variety of brain tumors, such as the Baptist Health Miami Neuroscience Institute.
I think when you are positive about something, that helps a lot. That helps the healing a lot. And when you have great staff too, everybody was super nice. I consider Baptist as the Ritz-Carlton. It's extraordinary.